Welcome to today's special event at eLotus. I'm Donna Chow, your host and moderator for today's class. Thank you for joining us. With over 20 years of hosting educational courses, eLotus is your trusted source for premium CEU content, offering 900 courses, 250 speakers, and 3,500 hours of continuing education. This month is an exciting month as we have 7 live webinars, and the topics include treating long COVID, geriatric patients with dementia, how to effectively prescribe herbs in your practice, advanced balance method, and 2 veteran speakers, both with over 40 years of clinical experience. Dr. Jimmy Chang speaking about herbs, and Dr. Dao Kai Fong speaking about acupuncture and chronic pain. You can find the details of these courses at elotus.org on our homepage if you click on the 2023 schedule. So for today's class, it will be held from 2 to 4 p.m. Pacific time. And before we begin, please set your chat preference to everyone for an interactive session. Questions may be asked using the Q&A box. And then after the webinar, you guys will receive an email to let you know when the quiz is ready so you can receive CEU credit. We are excited to present today's webinar, Menopause, Fibroids, PCOS, Endometriosis, Dr. Jimmy Chang's Herbal Master Sheet. Dr. Chang is a renowned expert in herbs and pulse diagnosis with over 40 years of clinical experience and having treated more than 500,000 patients. He has been exclusively supplied by Evergreen Herbs for an impressive 25 years, making them the perfect partner for his clinical practice and research. We are honored to have Evergreen Herbs as our sponsor for this webinar as well, given their commitment to quality and service. During the webinar, Dr. Chang will share his extensive knowledge in pulse diagnosis and herbal prescription, with a particular focus on his unique herbal combinations. You will gain valuable insights into pulse indications for specific conditions and learn how to prescribe herbal formulas effectively. Dr. Chang has previously conducted several courses for us, which are now available as distant learning CEU videos. For those interested in enhancing their pulse diagnosis and herbal skills, Dr. Chang is the go-to expert. We highly recommend the Gold Pass membership, offering unlimited access to his foundational pulse courses and herbs prior to 2020. And as a special offer, the Gold Pass includes an herb voucher provided by our sponsored Evergreen Herbs, allowing you to experience the mentioned herbs firsthand. This incredible value is perfect for those serious about mastering herbs. For more information, please feel free to check the chat room where it will provide additional details. So let's begin today's class with a brief overview of Dr. Chang's herbal approach, ensuring everyone stays on track. If you are a longtime student, feel free to review or take a 5-minute break. And so Dr. Chang's herbal style does differ from traditional methods taught in schools. He exclusively uses extract powders from Evergreen Herbs, offering around 300 single herbs and 100 formulas. In his pharmacy, Dr. Chang has approximately 150 single herbs and formulas, and you can find more information about his pharmacy in the YouTube video linked in your lecture notes. And for those interested in starting a pharmacy like Dr. Chang's, Evergreen Herbs is currently offering a 15% webinar discount on the essentials of Dr. Chang's pharmacy. You can find the link in the chat room or refer to your lecture notes for details. Formula evolution is a key aspect of Dr. Chang's practice. He creates his own formulations, giving them names based on their purpose. These formulas may change over time as he sees more and more patients and he makes these modifications. Updated formulas are denoted with a 2.0 to indicate a new version. Fang Jia Fang, which stands for formula plus formula. It involves combining different formulas to achieve enhanced effects. Evergreen's extract formulas are decocted and extracted together rather than just combining individual herbs. For a more detailed explanation of Fang Jia Fang, Dr. John Chen has a video explaining the concept in more detail. Dr. Chang's herbal prescription typically comes in 100-gram bottles, though for non-local or chronic conditions, he will prescribe 150-gram bottles. And when he does this, he offers a discount as well. So his recommended dosage is for a 100-gram bottle is 3 spoons 2 to 3 times a day. When reading Dr. Chang's prescriptions, if he lists herbs followed by a number, it means all herbs for that number are in that percentage. Or sometimes he lists nothing at all. And so that means they're all equal percentages. For example, in his depression combo with low blood pressure formula, He writes down 4 ingredients with no indications of ingredient breakdown. It's Renshen Yang Tang, Weizi, Huangqi, and Buzhong Tang. Can anyone guess what that means? Okay, I already told you the answer. So you got it. If you said equal parts, you're right. It would be 25% each. So if you're using a 100-gram bottle, then that's 25 grams of each ingredient. Regarding mixing herbs yourself, it is definitely an option. Some formulas like circulation sanjiao and astringent complex are already pre-mixed as collection formulas in Evergreen's proprietary line. However, many new formulas are not pre-mixed yet because Dr. Chang is still customizing it. So you can feel free to mix your own concoctions or use Dr. Chang's formulas as a base to create your own. All right, so that concludes my short introduction. Let's go ahead and welcome Dr. Chang to take over the class. Thank you very much, everyone. Dr. Chang, thank you for generously sharing your knowledge and taking the time to teach us all today. For our attendees, if you enjoyed today's class, we'd appreciate if you share your thoughts on social media to help promote both our speaker as well as eLotus. And as a reminder, the CEU quiz will be available no later than tomorrow evening, so look out for an email from me. Thank you guys for joining us, and we will see you at Dr. Chang's next webinar in October on the 18th on nephritis, hepatitis, and fatty liver. Remember to watch Dr. Chang's past courses, and you can find them at elotus.org as distant learning CEU videos. Bye for now.
Thank you very much. Thank you for the introduction from this pretty lady. Have you noticed that she's been speaking about over 10 minutes without having to look at the note? It's very smart and brilliant. Anyway, I've seen more than 500,000 patients before, so that means I've taken over 1 million pauses. So that gave me a little, experience and understanding about the pulse diagnosis. Now let me do the sharing now. Where's the PowerPoint? Okay. Okay, this is the topics we're about to talk about today. Menopause, fibroids, PCOS, and endometriosis, and a lot of things in the past, according to my understanding and my special way of treating this, which is very, very effective. Somebody says it's the first lecture with Dr. Jimmy Chen. Okay, you're gonna see something really amazing, huh? Okay, I learn everything from my patients. That's what you should do. Learn things from your patients, not from a textbook. Textbook totally, come on, it's kind of useless. Okay, now let's begin. We have a little condition here. It might happen in your clinic every day. A young lady sitting in front of you complains that she experienced some severe pain in the abdominal area and the bleeding heavily. There's little something logical here, but not so logical here. In my office, I don't ask patients, what can I do for you today? What's the problem with you today? I always starting my session with my pulse, not pulse first, the hand reading, the signs reading, and then the ear point reading, and finally the pulse diagnosis. And finally, after finishing all my procedure in about 3 minutes, and I'll ask, oh, no, what can I do for today? What do you want me to do for you? That's what I ask. I don't ask their problem in the beginning. And that's what you should do if you want to have a good practice. Don't ask. It's the goal of our training here. We do our process by ourselves, and after we find out everything that might happen or happened before to this patient, then we ask them, what do you want me to treat? Your back pain, your headaches, your insomnia, your period problems, something like that. So, but now this is opposite way, reverse the condition, which I never do. I just put this example here to show you, not everybody out there can do the don't ask drill. A lot of people, some acupuncturists don't even have a room or desk for diagnosis. When the patient comes in, they just send them to a couch, a chair, or on the treating table and start inserting needles. That's not what I do. We have to make sure that patient have the confidence in you, that you know her problems and you can fix her. That's the things to build up your best career in the future. Anyway, you're lucky. This lady has already told you what's wrong with her. And the pain, the abdominal, what would you do? What would you do? We do pulse diagnosis, signs from the hand and from the ear point. And we know, okay, your problem is from what I explained to her, then we do the treatment strategy. But anyway, this condition is not very common. Period pain and the bleeding is heavy is actually totally two categories. They usually don't happen together. But I'm giving you this just to give you a little bad time. So what would you do? Okay, start taking the pulse or what? But before our session today about the treatment or diagnosis of those female problems, I'm giving you this bonus. How can one enhance medical skills and learn greater trust from patients during consultations? Okay, this is what I am suggesting that you do. I think some of you that doesn't have much experience in treating patients. So some of them join my WhatsApp group, and I answer that question as much as I can. But this is the logic behind all my career. This is how I built up my career, by gaining the confidence from the patients and the best result for treatment. First step, based on the patient's verbal symptoms. Okay, you're lucky. She has been telling you all her problems in the past 10 minutes. Examine the corresponding pulses, position of the wrist, yin, yang, excess, deficiency, cold, and here is the condition deficient diagnosis. External factors like wind, cold, dampness, heat, or excess or deficiency in organs. So, hey, come on, you have a very weak liver, which means you have a problem with the autoimmune system. Mm-hmm. Or you have a big excessive liver fire. You're so stressed about everything and with a bad temper, right? And sometimes you're so bossy as yelling at your husband all the time. And physical and mental disharmony. We can do all that diagnosis from all my systems. And after doing that, oh my God, your body is so sometimes I told my patient, your body is like a volcano. We don't use the word yin and yang to the patient because they couldn't understand it. We just keep in our mind, oh, you have a lot of fire. You need some water to put off the fire. That's what we do. And excess and deficiency, oh, you're so weak. You can tell directly how weak the patient is by excess or deficiency. It can tell the difference easily by using the my blood pressure system. If the blood pressure is low and the pulse is fast, and this must be in excess or in deficiency, excessive yang, or the blood pressure is low, 90/60, and the heartbeat rate is about 70 or something, that's deficiency in blood and qi, then that will give you a very certain point, a certain idea of how to treat the patient's problem. we don't do treatment by their symptoms. That's not very good. It's not working at all. You must find out the real reason behind the patient's problem. Then we do the treatment. So this is the first step. Then determine the nature of patient's chief complaints by analyzing the strength, the weakness, excess, and deficiency of the pulse. This is our major weapon to make a good diagnosis and the strategy for treatment. And then prescribe treatment on conclusion strong. So this is most new, I wouldn't say newcomers, but anyway, most of inexperienced acupuncturists would do that. But stage 2, that's this treatment, is the training of our other classes in the past 25 years is to do the reverse approach. Instead of asking the patients, well, what's wrong with you today? Directly analyze the pulse and find the answers. Then ask the patient only at the last, what can we do? What do you want me to do for you? That's all I say. What do you want me to do? Your back pain, your headaches, your sleeping problems, something like that. Then proactively inform the patient about the area of concern associated symptoms. So I will write what I'm treating this patient on the label of my medicine box, so they will know what I'm doing. Oh, I'm treating your back pain. So if you have a little ringing in the ear, that's something else. So they will know what I'm doing, and they have a lot of confidence because we know everything they're having or they had. So that's the training. That's the purpose of the training here. That's the purpose that you pay money and learn things here. Okay? Any questions so far? Okay. So try to bear in your mind our treatment, our training, our class, our seminars here are making sure that you can do the don't ask drill. Then you have a bright future, bright career, and bright income, better than ever before. Okay? Oh, this is in Chinese. If you speak Chinese, and you can learn. 我们看看这个右关词转脉象的有余、虚实寒热、风寒暑湿燥火，或者五脏六腑的有余不足。有余就是太强，不足是哪里虚？你今天有肺火，你今天有肝不足什么等等的啊。像我们今天讨论的是妇科，所以是肾，以中医讲的肾就是妇科方面啊。然后根据脉象的虚实寒热来主动的告诉患者你有什么问题，所以我们这种诊法叫做主动式的张氏脉法，不要去问你哪里不舒服啊，绝对不要这样问，这样的话病人会把你觉得当成你只是一个工匠开个处方而已，人家对你不会有什么尊敬的啊。然后反向的操作才是正确的，不要问患者哪里不舒服，直接从脉象上去找答案，然后主动的 ，that's the point， 主动的啊，这才是我们做医生的最高境界。我怎么看不到这个 chat？ Oh, okay. But don't ask me. Okay, good. Okay. Okay, let's get on to the first category of today's things. The menopause syndrome. It's kind of very popular. Looking at the history, oh, this lady is 49 years old. Oh, come on, she's in her menopause syndrome area. So you should put more attention to her female problem. It refers to a series of physical and emotional symptoms that women may experience during the menopause period. So how do we put our attention to those hidden problems that this lady might have? So we must have to check the pulse to know the condition. Is too much or not enough? 所以更年期就是这些身体的症状，因为主要是 is the 卵巢功能下降. Basically, it's decrease. Sometimes when I check the pulse, I will tell you how to check the pulse. Even the lady is only 35 years old or 40 years old, I still can tell them, hey, you're in the early stage in the of getting old. You're so aging too fast. Your body is much older than your age. Most of the time, I was correct. Actually, 100% correct. They always nod and say, oh, yes, I'm so tired all the time. I'm so emotional. So treating emotional problem is not just emotional problem. You should focus on something else. It's mostly those crazy ladies with a kidney young fire. They are so bossy and so aggressive, so stressful all the time. So if you use some 加味逍遥散, it's not going to work. It's because their problems coming from the hormone. That's what we are dealing today. Hormone. Everything's hormone related today. No, so I'm sorry. So the symptoms are not so important. We cannot treat patients based on their symptoms. We do things based on their body condition by taking the pulse and everything. That's our goal. Okay. Oh, this is the most things you should learn today. Okay. This area is the normal pulse, 寸关尺. Okay, is thick and strong or something like that. And see this? This is the 少阴. It is called part 7 because in the 神门 area. And this is the tendon, and there's little pulses here. Also, it has 寸关尺. So, for example, for a lady, right hand is young, kidney young. Left hand side is kidney in. Same thing with a gentleman, same thing. So a normal lady like a 35 years old, young, shouldn't be too much. But on the other hand, the left hand side should be strong, theoretically, naturally strong, because she should have good female hormone all the time. Let me tell you something funny. If a lady, the right hand side, the heart 7 pulse is very strong and jumpy, then you can directly tell your patient, hey, you're so bossy. You yell at your husband all the time. They always laugh and admit. So this is the young, for the hormone. You may say heart 7 is the hormone pulse. So be sure you learn it and try to feel it all the time. That's what I do. I take the pulse here and I take the pulse here. And as for this area, see, there's a little triangle here, right? This is the abdominal area. If they have a sign, something like this, they have a cyst. Actually, in this condition, they have something down there in the genital area. Look like the dark color here, they have dead blood stagnation, maybe in the uterus from the previous unclean period. And for men, for elderly people, that might be prostate or something. So notice this place all the time. It's genital area. Questions? Good. Tina is explaining everything to me. Oh, thanks to her. Good boss. Okay, so you must learn this pulse all the time. After you take the normal pulse and go to this heart 7 pulse. Okay. So what we do, what we are facing, what condition we should be alert with is the hot flushes, and night sweat. They always have this. Looks like from the symptoms point of view, it looks like some fire, heat, sudden sensation, heat. Oh, sometimes very hot, but not necessarily. There's something hidden behind all their symptoms. Don't jump to the conclusion, this lady has sweating and redness, this must be hot. We can simply use some cold medicine to deal with it. Not necessarily, not 100%. Night sweat, they always have this. And the pulse might be jumpy and affect sleep qualities. So most of this lady around there, 50 or something, they have this problem. We cannot just try to calm her down by using 酸枣仁汤 or okay, let me do this. Okay, wait, can I use 姜维逍遥散 something for the sleeping quantity? Oh, here, sorry. That's funny. Okay, anyway, we cannot just simply use 酸枣仁汤 or something to calm her down. It's sometimes useless. The pulse may be chi area is long, forceful, and jumpy, and that we call kidney fire. The chi area. So 这症状是这个突然的潮热，身上热，还有脸上也热，出汗。So the best formula combination will be this to cool down the kidney fire. So 左归丸, we have two. 左 means left. Another we have a right 归.右归丸. 右 means right. 左 is for kidney fire. Right, the 右归丸 is for kidney yang deficiency. Weak, young. She's cold and tired all the time. 直柏地黄丸, sometimes we put this together, just cool down all the kidney fire, which means something like this. And then we use this one together with astringent. That's my best, my all-time great combination for any kind of fire. It doesn't matter in the chun or the guan or the chi. So all in the heat, you can use astringent complex. If you don't know what the inside, you ask Tina. So I put them all together to clear the heat fire. And that's after applying that, we can help her to get better sleep, sweating, and all the fire on the unstable emotional stress, and everything will be better by adopting this. As for how to take the pause, how to take the herbs, we'll be explaining it at the end of today's seminar. Okay. Ooh, so many questions. I am so new. I'm limited to my question. Just so. Okay. So put this 3 together, 33. I'm using 33% here just to explain you that you should do 100 gram a bottle of herbs or 150. I do 150, like enough for 10 days or 12 days. So you can use 50%, 50 gram of this, 50 gram of this, and 50 gram of this. It depends on your habits in using herbs for your patient in your clinic. So this is the best combination for kidney fire. Not necessarily for the sweating and the heat and the hot flushes here. This is also good for infertility. Ladies with a very abnormal prolactin hormone balance, I use this to cool it down. And not only for a menopause lady, but even for like a lady with 30 years old, they have some kind of a kidney fire, abdominal hormone balance, I use this for cooling it down. Okay, and not only for ladies, for men too. People, gentlemen, young guys, 20 years old or 40 years old, 50 years old, or even 70 years old, they have the kidney fire, which affect their urination and hormone and sex ability, and everything comes. Mostly it's emotional. We can use to cool him down and correct and help with the urination and hormonal performance. That's the saying. Okay.